name's Alex, and thank you for joining me on Alex Talks Nursing this week. So for this week's episode, we're going to be talking about otitis externa, also known as swimmer's ear. So if you ask why I'm here in the middle of nowhere in the crack of dawn, I'm actually at the UTEP Rec Center, about to get my swimming workout on. So being an avid lover of swimming, I've experienced swimmer's ear many times. So I'm going to give you first-hand knowledge on how swimmer's ear occurs, some of the symptoms, the treatments, how to properly install eardrops, and then lastly, how to prevent swimmer's ear.
This is our external ear canal. Everything from the tympanic membrane outward is considered the external ear. As trauma occurs or a foreign substance such as water enters the ear, the skin of the external ear canal breaks down. The skin becomes inflamed and begins to swell as part of the inflammatory response. This leads to itching and pain of the ear. The earwax and sweat glands of the external auditory canal also become obstructed. The environment of the ear changes. The ear canal becomes warm, moist, and an alkaline environment, perfect for bacteria and organisms to grow. Symptoms of swimmer's ear often include ear pain, decreased hearing or fullness of the ear, sometimes itching of the ear, discharge from the ear that goes from clear to whitish yellowish, eczema outside of the ear, and lastly, swelling of the ear canal. Children's Motrin and Tylenol are great medications to treat ear pain. For children, they can be given in alternating doses as needed for pain. If indicated, a medical professional might sometimes remove earwax or debris from the ear canal. Antibiotic eardrops are often the first line of medication given to treat the infection. Sometimes oral antibiotics may be given. Lastly, we should avoid the causing factors of the swimmer's ear. In this case, we should keep the ear as dry as possible while it heals.
So the first step, just like with giving any kind of medication, is you want to properly wash your hands. So before we put the eardrops into the ear, it is suggested that you keep the vial squeezed in your hand. And what this will do is this will warm up the drops, making it much more comfortable for the patient. So you'll go ahead and go to your patient. What you want to do is you want to have the patient lie on the side of their head with the affected ear laying up. Right here on the earlobe, you'll want to gently grab the top right corner of the earlobe. You'll gently grab it, you'll gently pull it back and in an upward direction. You'll then go ahead and remove the stopper from the vial, and without touching the patient's ear, you'll gently drop some eardrops gently right on the side of the ear so they can flow into the ear canal. You'll then want to have the patient go ahead and lie on the side of their head for about 5 minutes. This allows the medication to get into the ear canal. If you're going to have to put eardrops in the other ear, you'll want to, again, wait 5 minutes and then repeat the process and lie on the other side for 5 minutes.
So what are some ways I can prevent future earaches?
So the key to preventing swimmer's ear is to just keep your ear as dry as possible. After practice, when you're done changing, what you want to do is you can take a towel or a washcloth, just hold it up to the side of your ear and just bob your head gently this way. And that'll usually get most of the water out of your ear canal. Alternatively, if you have really sensitive ears, what you can also do is take a blow dryer, put it onto the lowest setting, and hold it about a foot away from your ear. And usually that'll help as well.
I also see some of my teammates using earplugs. Should I do the same?
With earplugs and with Q-tips or anything you put in your ear, you kind of want to avoid that one if you have really sensitive ears. What happens is you put the earplug or the Q-tip in your ear and it can actually damage the ear canal. Usually a proper fitting swim cap's a good solution.
How long will I have to sit out from practice?
Otitis externa or swimmer's ear usually lasts about a week. So you should just stay out on the sidelines and just use your eardrops as instructed for about a week. If it doesn't get better in a week, then you're probably going to want to follow up with your doctor for more treatment.
My ears always seem to feel full after practice. Is there anything else I can do for that?
So certain people have ears that are more sensitive to water. What you can also do is they sell over-the-counter eardrops, and you'll just use them as needed. And what it'll do is the eardrops will help dry your ear, and it'll also keep the environment inside your ear acidic, so it prevents you from getting further infections.
Thank you.
Thank you for joining us this week on Alex Talks Nursing. Join us next time for when we go over asthma and how to deal with it as the weather changes.